So I have had a lot of clients have a lot of success with ketamine. One in particular comes to mind. He had been struggling for years with depression, had a failed suicide attempt, lost his job, his wife filed for divorce, and he was really at the end of his road. Very bright, wonderful man, but just felt like his life was out of control. So he wanted to try something different, and we got started with ketamine, and really just an incredible transformation. He has been able to find hope again. He notices that he has more confidence. He got through a very difficult divorce. And he has identified that, if I didn't have the ketamine, I would really not be able to get through all of these huge life challenges right now. So, divorce, trying to find a job. And so it's been very successful for him, and he is really a big proponent of ketamine and feels like it's been a life change for him. What's nice about ketamine is that there's really not many side effects to it. So one of the things to keep in mind, some clients may feel nauseous, they may get dizzy, certainly you're not able to drive a car afterwards, but the side effects are pretty mild and they can be mitigated if someone knows that they tend to get nauseous or they have a journey where they felt sick the whole time. The medical prescriber can make sure that they have Zofran or something that will help with that. And typically, after, depending on the dose, of course, and the person, people are able to function the next day. So they have to go to work, they feel fine the next day, is what I typically find with my clients. So it's really a nice side. It's nice that there's not a lot of side effects with ketamine. I think to your point about addiction and monitoring that, I think what's nice about the model of ketamine when you're working with a therapist is that they're taking it in your office, they're letting you know how much they're taking. You are working with the medical team as well to make sure that it's not being abused or they're taking too much of it or taking it when they're not in your office. So I think it can be closely monitored to minimize that risk of addiction of ketamine. I am familiar with companies such as MindBlue, where you can have it sent to you, and I've in fact tried some of those, but you are in your home, you maybe have a therapist afterwards that you can talk to, but it's not the same as really having that physical presence and having your therapist there and experiencing it, being able to share afterwards. So in certain situations, I think it makes sense because you may be far from somewhere where you can work with a therapist who is able to guide you on a ketamine journey, but I really feel like the most benefit therapeutically is really having the presence of in-office. In-office, feeling comfortable. After 3 to 6 sessions, if we feel it's appropriate, they're a right fit, they will work with a practitioner, a medical doctor who can prescribe the ketamine. And then we work together in my office where they come in, they bring the medication, and I do it sublingually. I also have the option to do IMs, but that's less frequent. And so it dissolves under the tongue, and then they go on a journey, and they're there from 2 to 4 hours. Typically, after 4 hours, they come out. We do, some small talking after. We're not doing integration. And then following the journey, we do integration within 24 to 72 hours. So it feels very familiar for them. We do beautiful ceremonies before. We do their intentions. And then typically, I find with clients, because of busy lives, just as you were saying, Kendall, that it's challenging to do several times a week. So clients will typically come in once a week or once every 2 weeks, and we try to do that and work around their schedule. What's nice about ketamine is they can come in the afternoon and then the following day be functioning and available to work and kind of be back to normal. So similar to what everyone's been saying, ketamine is really nice because it doesn't take a whole weekend or a whole 5-day period of time to get the benefits from it. So it lasts for 2 to 3 hours. It makes it much easier for clients to come in maybe at the end of the day and be able to have a journey and all the benefits. So ketamine, I think what is a game changer about ketamine is that within a couple of hours after a ketamine experience, or a couple of days, you'll get the antidepressant effects of it and an uptick in mood. So that's really unique and that with antidepressants, you have to wait for at least months, sometimes up to a year to get the correct dosing, and sometimes it's just mild to moderate benefits. So ketamine really offers for clients an immediate benefit in you noticing that they feel better, and it's really pretty fantastic in terms of suicidality, reducing that. So clients who are really struggling will get the benefits quite immediately. So it's very useful for working with clients who are struggling with depression.